Hello there, this is Dr. Z's Health Education Project, and this is Dr. Zaidi here, and in this video I would like to talk to you about the treatment of wet macular degeneration, or wet AMD. Let's suppose you've just been diagnosed with wet macular degeneration, and you're wondering, well, what are my options? First, let me briefly review what is going on with wet macular degeneration. And if you want more details, you can watch one of my other videos on wet macular degeneration. But to review briefly, we have in the back of the eye a layer called the macula, which is a specialized part of the retina. We have a barrier layer, which I'll call the pigment layer, and then we have a blood vessel layer under here. And this barrier layer, in brown, keeps the retina here and the blood vessels here. In wet macular degeneration, there is loss of this barrier layer and holes form in that barrier. These holes allow for blood vessels to grow from underneath the retina through this defect in the barrier layer and form a network inside of the retina. And then, of course, unfortunately, these blood vessels bleed, leak fluid, and form scar tissue, and often form a scar in the center of the retina, resulting in central vision loss. So that's the basics of how macular degeneration works. Now, let's talk about what are your options. Well, one option, and you always have this option no matter what situation you find yourself in, and that is do nothing. Official medical term for this is observation. So do nothing. And doing nothing is a great option if you have a common cold or a common headache, because doing nothing often results in the disease getting better by itself. Unfortunately, for macular degeneration, the wet macular degeneration in particular, doing nothing is not a great option, because the blood vessels that grow into the retina usually don't heal themselves. They usually bleed and form scar tissue, which often results in loss of the central vision, or a big blind spot right in the middle of your vision. So doing nothing for this condition is not a great option. Number two, treatment. Right? So let's say you decide, well, I don't want to do nothing. I want to try to save my vision, recover my vision. I want to get treatment. So what are your treatment options? Well, the most common, most effective is medication. Placing medication into the eye to treat those blood vessels. This is the most common form of treatment, and this is what I'm going to talk about. I'll also write another category of treatment, which I'm simply going to label other, and put that in little quotes because it represents a lot of other categories. Prior to the development of medications, we used to treat macular degeneration with laser. There was hot laser, there was cold laser. People have tried surgery. People have even tried radiation to the blood vessels. But frankly, none of those treatments is nearly as effective as medical treatment for wet macular degeneration. And with medications, we basically have three most commonly used drugs, and I'll list them in chronological order. We have Avastin, which really came out for use in the eye, started using it around 2005. We have Lucentis, also made by the same drug company, Genentech, 2006. And then finally, the newest sort of player on the market, Eylea. And this is made by a company called Regeneron, and this came out in 2011. There are some other drugs, and if I was writing a textbook on this condition and all the treatment options, I would include steroids. I would include another drug called Macugen. But for the sake of this video and for simplicity, I'm going to only list here the three main drugs, the three most common and the three most effective medications for this condition: Avastin, Lucentis, and Eylea. Now, a brief word on how these drugs work. If we go back to our little diagram here, and we have here a case in which blood vessels are growing and bleeding into the retina, how do these medications work? Well, if we go back to our analogy that these blood vessels are like weeds growing in the grass, weeds need soil, they need sunlight, they need water to grow. And these drugs basically block the nourishment and some of the chemicals that these blood vessels require to survive. And by doing that, by blocking off their food supply, so to speak, weeds regress. So if we take these blood vessels and we apply Avastin and Lucentis or Eylea, one of these three medications, typically what happens is we see the blood will clear up and the blood vessels kind of go back down to where they belong, and we're left with the macula back here. So let me finish spelling that out just for the sake of completeness here. So we'll go back to macula. So you're going back to a more healthy macula. Now I want to point out something very important here, that these drugs have attacked the nourishment of those blood vessels, causing them to regress, causing the bleeding to go down, limiting the formation of scar tissue in the retina, limiting the vision loss. However, they do not restore that barrier layer. So if you notice here, this barrier layer still has a big defect in it, which still allows these blood vessels to grow back into the retina. Ideally, we would have a drug that not only caused the blood vessels to regress, but also replaced that barrier layer. So that way the blood vessels could not grow back. Unfortunately, these drugs do not do that. So although they have a lot of positives, they are not a cure. They are not a permanent treatment. Think of it as causing the blood vessels to go back into remission, but they often do come back. So it's just like the weeds analogy. You put weed killer, you pluck the weeds out of the garden, but a month later or 6 months later or a year later, those weeds grow back. So let me summarize here. Whenever you're dealing with treatment, and I've highlighted here the three main medical treatments for wet macular degeneration, one has to ask, well, doctor, let me see if I can get this in green here. What are the benefits of treatment? And what are the risks of treatment? So here I'll list benefits, and over here I'll list risks. So right here, risks. So benefits of treatment, 90% of patients maintain or improve their vision. That is a big benefit. If you talk to any retina specialist that was practicing prior to 2005, before Avastin came out, they would tell you that there was really no treatment to improve the vision and hardly even to prevent vision loss. So when you tell me that there's a drug that in 90% of patients maintains or improves their vision, that is nothing short of a miracle. So that is the benefits. Even though the drug has to be given repeatedly, even though it's not a cure, it is a major step forward for the treatment of this condition. But now, what are the risks? Well, there are two main risks that one has to worry about as far as the eye goes, and that is infection and retinal detachment. Now, there's one thing that I've neglected to mention, which is how do we get these medications into your eye? Unfortunately, it's not a pill, it's not a drop, but these medications, Avastin, Lucentis, and Eylea, must be injected into the eye in order to be effective. Now, if you're like me and you heard that for the first time, that you have to have an eye injection, that sounds pretty horrible. But let me reassure you that it is not as bad as it sounds. We have developed techniques to numb the eye so that patients can have these medications injected without significant pain or trauma or stress. And for many patients with wet macular degeneration, they come in every month and they get their injection, and they would tell you that it is not a horrible experience. It is annoying, it is a nuisance, it's like getting a flu shot, it's irritating, but it is not a traumatic and painful experience. However, there are some small risks with having an eye injection, and that involves an infection or a retinal detachment. Now the good news with that is that happens really less than 1 out of 1,000 times. So if you do 1,000 injections, you may get one of these complications. In fact, it's probably less. It's probably more like 1 in 1,500 or even 1 in 2,000. But just know that the risk of an infection or retinal detachment is very, very low. It's not zero, but it is very low. The other risks that I should mention are also very low, but are worth mentioning, and that is these drugs, there have been some indication in reports in the literature that these drugs may have some what we call systemic side effects, meaning they do get from your eye into your bloodstream, and there have been some cases perhaps of high blood pressure and even stroke or heart attacks or heart disease from these medications. Again, the risk is very, very low, but it is something that you should be aware of and that you should talk to your doctor about it. Now, in this video, the purpose is not to say which of these 3 drugs is better, which is the best treatment. That is between you and your doctor, and that depends on the patient, that depends on the situation. But just know that the medical treatment with one of these 3 drugs of wet macular degeneration has been a miracle and has saved many people's vision. And we're very happy to be able to offer this treatment to patients. Of course, we hope that even better treatments will come out, treatments that don't have to be given every month or so frequently, treatments that have less side effects and less risks, and stay tuned for that. But thank you for your attention, and I'll see you in the next video.